Hi guys, so today was infusion number 7 and it is probably going on about 5-6 hours or so since I've been home, but I'm now more alert to write to you, but I'm still feeling the effects. They increased the dose today and they're doing it slowly because I tend to have reactions to medications. So rather than doing a big jump, they're doing a slower incremental jump. And they went up to 180 milligrams today. I tolerated it very well. The nursing staff was awesome as usual and didn't have any problems really with the infusion at all. I will tell you that I was completely out of it, and you feel like you're out of it kind of forever. But one thing came to mind that I thought I would share to you, and that is when you're going for this type of treatment, it's a really good idea to dress like you're going to bed, dress comfortably. I have found that I have a tendency to layer, so it's just the way that I choose to dress, and it it was making me too hot while under the infusions, and that was adding to the nausea and to some of the vomiting that I had. So by basically, wearing like a short sleeve or a tank top or in a comfortable pair of pants that's, like sweatpants or something like that, or pajama bottoms or something like that, or a nightgown, something that you're comfortable in that, you can maneuver in and out of the house. I have a cape that I love to wear because no matter what I'm wearing, I'm covered by that cape, and that gives me a little bit more leeway. So I kind of go in my pajamas in a way, and you curl up, and I had my pillow, and it definitely was a benefit. Apparently today I was at a some type of celebration, and apparently we were having a grand old time, and I've made a few people laugh. I have no idea. Um, I have to laugh at it because otherwise I'm going to be disturbed. I mean, having this much amnesia is hard. It is hard. You repeat yourself. You don't remember things. People tell you things, you don't remember them, or you don't comprehend them. You hear the words, but they're not making as much sense to you. That kind of a thing. I have to crack up laughing though, because it seems I had a different nurse today, by the way, and she was wonderful, absolutely wonderful. And but I have to laugh because all of the nurses leave the pigtail like undone, from the port. So here's the port, and you can't see the needle because it's covered over by a protective bandage and then by the gauze. But this is like the pigtail that they access, and it's funny because apparently I play with this thing, which I'm gonna stop doing that. But and I do distinctly remember my other nurse telling me to stop playing with my fort. So apparently I play with the thing, which is really kind of funny, especially when you consider the fact that I'm like so not comfortable touching it. It's kind of funny that under the infusions, I'm actually kind of goofy about it, which is a good thing. I will tell you, dark humor is, and humor in general, is just one of the greatest gifts that you can give yourself, is to be able to laugh at yourself, laugh at people around you, and go with the flow of it. Like, even when I'm having a bad day, and it's hard to get up and move, and I need to ask somebody else for a glass of water or something, it's still fair play to have fun and come up with something funny or pick on myself. I find that when I laugh about myself, it is a lot easier to handle all of this. It is a devastating diagnosis to have CRPS, or also known as RSD, reflex sympathetic dystrophy, or complex regional pain syndrome. I know it. See, they give us so many acronyms. I start to lose track of all the alphabet soup that is associated with my medical care. Yeah, but you have to kind of giggle sometimes because that is one of the best ways to help yourself. And I will tell you, I even under sedation, even under the medications that they're giving me, and there's 4 different medications they give me every single day while we're doing these loading dose infusions. And I still remember how to meditate. If one of the nurses gives me a cue, like tells me to concentrate on my breathing, I will do exactly what I do on a regular basis. And I will concentrate on my breathing. I will audibly, they can hear me taking big deep breaths and controlling my breath in, controlling my breath out. And by doing that, I can help keep myself calmer and keep myself in a better state of mind. Because if you are upset or anything's going on, you're going to take that baggage in with you. And when you're under, your subconscious mind is going to bring it to the forefront, which then makes things a little bit more dangerous for you. You don't want to have a heart attack or a stroke because your blood pressure's through the roof. So you can't be getting excited. So again, I'll reiterate what I said yesterday in yesterday's video blog was that, you've really got to isolate yourself in a sense of keeping yourself away from negatives, stressors, things of that nature, and trying to stay as calm and as happy as you possibly can. In that peace, I've found inner peace in a lot of ways, I will tell you. But I don't want to get too philosophical in these videos because my aim is really to share with you the experience. It's when you're getting the infusions, there's this great sense of detachment. Like you're in another world, they're in a different world. And then every once in a while you kind of realize where you are. You might open your eyes for a second, and if you can focus on, say, the nurse or the monitor, because you're fully monitored. An appropriate facility is going to be very clean, very organized. They're going to know their stuff when it comes to these medications. They're going to have everything double checked, triple checked, all the safeguards necessary. They have me on a cardiac monitor. They have me on a monitor for my blood pressure, for my pulse, for my oxygen level. They're always eyeballing me and making sure they visually see me and see that I'm doing okay. I know these things because I've had a loved one in there with me, and they've told me about what the staff does when I'm under. And that is a comfort to me. They're aware of my particular special needs in that I have portable oxygen for emergencies, and that stays in the room with me, but they also made it a point of pointing out they have oxygen there too. So they have all of the emergency equipment necessary should an emergency arise. So with that in mind, I have given permission for them to go to whatever they feel is the therapeutic dose for me. I'm not an expert in this thing. They are. And I told them I need to lean on your expertise. You deal with this every day. You see it every day. What are your recommendations? So with the ketamine infusions this far in, tomorrow we're going to go up again. They're going to go up to 200 milligrams, and they're going to hold at that point. I don't suspect they're going to be going up any further, but I guess, you see how things go. And then these infusions have to be repeated in order to keep the levels up in my body so that my nerves stay tempered down a little bit more. What we have discovered is that it doesn't do a lot for the abdominal swelling or the abdominal or chest tightness is still there. It might be a little bit reduced, but that tightness is still there. It's not 100% gone. Maybe it will be by the end of the loading doses. I do have hope. I have had a little bit of a decrease in some of the burning sensations, but I'm still getting them in both arms. So that's an indication that the CRPS is obviously still present on the right side. We're hoping that it will completely reverse. And I still have 3 more treatments to go, and there'll be booster treatments. So we'll see how this goes. I'm not counting it out yet. I did try and use a cane today, and unfortunately that did cause some pain in my hand and my lower arm, and the nurse suggested that maybe I was being a little too quick to try And it's still better for me to hold on to people because that's the best bet for me to try and get around. I've really been housebound for the last 2 months, and when I do go out, I go out with my loved ones, and they basically hold on to me, I hold on to them, go to the car, and they pull up to whatever the doctor's location is or particular appointment, and we go in together and come out. But in this instance, after the infusions, they have to bring me out in a wheelchair, and I'm completely unsafe. Very difficult for me to move around and to navigate anything. I really have to have people by my side. So when you're doing this, you do need to have somebody with you, and you need to have people that are going to stay with you when you get home. So there's somebody monitoring you, there's somebody keeping an eye. If you happen to wake up and you're still somewhat under the influence, that they're there to ensure that if you're getting up out of bed, you're getting up safely. Which, I've had a few near misses. I will be honest, I have climbed up out of the bed and almost went butt over tea kettle and and found a new way to find the floor. But thankfully, my loved ones are always looking out for me, so they keep me from doing that. They're all about no more bruising. So is my nurses, incidentally. They keep a death grip on you, boy. You're not going anywhere under their watch, which is really, it's nice. It's nice to be, if I can say one other thing, I would say, and when you're picking a place to go, make sure that you can say you're comfortable with them, and make sure that they're meeting your needs as a patient, that you feel confident in the medical care you're receiving. You have to have that confidence. This therapy puts you at the most vulnerable state that you could ever be in. Understand that this drug has been misused. It has been misused and abused on streets. It has been misused and abused as a date rape drug. It's odorless, tasteless, and colorless. So you really, really, really have to make sure that you're with smart people who know what they're doing. My direct physician that is overseeing my care is actually the medical director, and a very accomplished anesthesiologist who's one of only 6 in my particular state that the RSD Foundation in the United States recommends in my state. So I looked for that in part of doing my research. You really want to do all the research that you can, and you want to go and visit these places and look for comfort. I can say that in a previous experience with a so-called pain care clinic, I found them to be very unclean. There were errors with medications that could have been risky. Some of these places are too busy trying to process people and not paying enough attention. You need people who are going to be paying attention and and you want people that, in my opinion, that are going to be moderate about medications. I don't personally like doctors that are willing to throw medications at you, whatever the problem is, or we're going to throw a medication at it. I like doctors that are conservative in their care, and for me, what's important is that when they do decide they're going to do a medication, that they trial it at a lower dose and slowly work up to what would be therapeutic, and not try and hit there too fast. And that's because for me, in my genetics, and the way that my body processes medications, I need to be cognizant and make sure that the staff is aware of it as well. One of the greatest things that I did was, with the genetic testing, was also having it tested as far as how my body metabolizes medications. So we know what medications are okay for me, what medications may not go very well for my body. So we know that with this particular medications that they're giving me, my body tends to metabolize them fairly moderate, which is not that bad of a way to metabolize it, but it also means in my genetics, I have a variant that causes me, unfortunately, to feel pain more profoundly, which means that it takes more analgesics in order to work. So I think that that's part of their thinking, and the reason that they want to go up on this was looking at my genetics, what would be a therapeutic level. And we're trying hard to knock out the spreading of the CRPS into my right side. The post-mastectomy syndrome has gotten improved, There's been, there's still a bit of an iron bra feeling, but it is not as bad. And pins and needles are reduced right now. What I'm hoping is that when these loading doses are over, that I get a good effect that stays for a while, and hopefully we'll be able to space out these treatments so I won't have to get them all the time. But right now, the prospect is that I'll be getting them once a month. It is expensive, and it's going to be expensive until government steps up to the plate and stops calling this experimental when it's been used so successfully. Oh, excuse me. That now they're actually breaking into mental health issues such as PTSD and depression with a similar treatment at lower doses and for a shorter period of time than for treating serious pain issues like CRPS and post-mastectomy pain syndrome. If you think of any questions, please post them below in the comment sections. I hope you like the video and subscribe, and I hope I'm helping you see what it's like to have complex regional pain syndrome type 2 and post-mastectomy pain syndrome and go through the ketamine treatments, which is the latest and most available treatment in the United States. Until there are more, we've got to keep sharing. There's only approximately 200,000 of us in the United States in treatment each year. Of those, 7% are type 2 patients like me. We need to help each other out and stick together. We don't have a champion out there championing our cause like we do in breast cancer or in other situations. So we've got to be our own champions, and we've got to keep being a voice out there and speaking up. If we don't, nothing's ever going to change. And I have hope for a cure, and I hope you do too. Take care.